Hi, this morning we're going to talk about pelvic tilt exercises. They're extremely common in Pilates classes and in terms of exercises to strengthen your core and to help support your lower back. So they're very important, but a lot of people don't quite do them correctly. So today I thought we'd run through how to do them properly, especially if you have back pain. So when doing a pelvic tilt exercise, I actually encourage the use of a pillow, because it means that you're actually going to do it from your lower abdomen upwards rather than from your head and neck downwards. We're going to get in the right position. So you want your head on the pillow and you want your knees hip width apart, not tight and touching but hip width apart, and you need to have yourself so that you're comfortable and in a good position, okay? Ideally you have your hands on the floor, palms facing upwards. If your palms face downwards, you automatically start to tighten your anterior fascial chain, which is part of the chain we're trying to exercise, but it's the lower abdomen we're trying to do, not the upper bit. So palms up. So palms up, and then the first thing that we do is imagine tightening our lower tummy. So you almost have to clench and pull up. When you have problems finding your pelvic floor, imagine you're trying to stop yourself going to the loo. It's those sort of muscles that you are using. So you tighten your muscles, and then the secret to a really good pelvic tilt is you actually use your glute muscles, your buttock muscles. So in this position, you then clench your buttocks as tightly as you can, squeezing them together. And the buttocks and the pelvis are what do the tilt. So if I put my hand under here and hand under here, you'll see a pelvic tilt is all about pushing the body back. So I'm tilting my pelvis backwards. I'll do it once more. So pelvis is here, I'm in neutral, the glutes are on, and they're pushing me back. So you're almost pressing your tummy button right down into the floor, and that is a good pelvic tilt, but I've still got my glute muscles really nice and tight. So we'll just do that once more. I'm going to show it to you again, but slightly nearer camera so you can see the action that we're trying to achieve. So I've got a little hollow at the moment under my back here, and that's because my spine is in neutral. I haven't collapsed in. I've got a little bit of tightness going through right into my lower abdomen. I'm then going to take my glute muscles and clench them together nice and tight. My knees are still hip width apart at this point, and then I'm going to use my buttocks to take out this hollow and push my back into. So you'll see now, there we go, good pelvic tilt, and relax. And it should all be very slow and relaxed. I'll do it again with my hands on my hips so you can see. And that's the pelvic tilt. Now when I get there, I can increase it with breathing. So we use the diaphragm again to always strengthen these exercises. It's fantastic. So I'm just going to relax my pelvic tilt, squeeze the buttocks together, tilt backwards till I really feel my lower back pushing into the ground, and then deep breath in, and then breathe all the way out. And then breathe normally and relax the pelvic tilt. The breathing in and then out really makes your lower abdomen muscles work harder. It's a really easy way to make you work just a tad harder than you would normally. I hope you enjoy that exercise. Pelvic tilts can easily become a great part of your back care routine, and they're just really good for you on quite a few levels. The breathing is also good because it helps aid relaxation, but also makes the exercise more effective. So have a go, enjoy, but remember, always use your glute muscles to do a pelvic tilt. Cheerio!